For all the hype being spewed by the mainstream establishment news media, an analysis of Maine's critical care bed usage over the past 2 months illustrates the lackluster performance of what the mainstream media was building up to be their superstar virus. This chart illustrates the weekly average use of critical care beds for COVID-19 versus all other illnesses and issues where patients ended up in a critical care bed in Maine. The weekly average for COVID-19 patients in critical care was around 19. Meanwhile, all other critical illnesses hovered just south of 150 before skyrocketing to over 200 by May 30th, with the upward trend continuing through the following week. Intriguingly, the all other illnesses category began to skyrocket a little over a week after Governor Mills issued an executive order for everyone to, quote, stay healthy at home and to wear face masks while in public. Meanwhile, the average COVID-19 critical care patient numbers remained unchanged. The Maine CDC lists around 300 to 400 critical care beds in Maine, depending on the daily availability. Currently, COVID-19 use is only accounting for less than 10% of beds in use, substantially less than the mainstream establishment corporate news media sources have been suggesting with their false or skewed news reports. These stories and more in the print edition of the Fort Fairfield Journal. For WFFJ-TV, I'm Dave DeShan.